It depends on the chairs and your back and everything else. Yeah. Okay. Well, feel free to get closer if you like. With the tall with the tall chairs, you can bring them closer. If you. Oh, that was a good idea.
But I tell you one
It's a
thing,
good
our
idea.
vision's pretty good right now. I had
Oh, thank God for
cataract
that.
surgery and glaucoma surgery in
Mhm.
December and January, and he
Okay.
had cataract surgery 3 or 4 years ago. So both of us don't even need to wear glasses for
Yeah, they've
driving
been
now.
doing like almost like LASIK surgery
Yeah,
along with that cataract
yeah,
surgery.
yeah,
And
and
so
it's
it's been really
amazing.
helpful for people.
Oh, it is, it
Yeah.
is. And I have worn glasses since I was 50.
Oh
When I turned
my.
about 50, I had to
You
start wearing
needed
them.
to.
I'm now 76, so yeah, I've worn them a long time. I'm glad to give
Yeah.
them up.
Well, I've worn glasses
Yeah.
my whole life, and then I got LASIK, and then I got older, and so I had to start wearing again. Hello.
Hi,
Welcome. I'm Dr. Lena. How are you?
I'm good. How are you?
I'm great,
My name's
thanks.
Laura.
Laura, let's get you to. I'm gonna write it down here because if you write like Yvonne and Gary, I might not be able to read it. What's your last name, Laura?
Sales. SAY.
All right, Miss Laura Sales, welcome.
Thank
And I'm
you.
pretty sure I've got your number because we've been texting. What's
Mm-hmm.
your email address?
It's Laura.sales.
That's easy. All right.
1978.
All right. Well, welcome, Laura. Glad you could make it.
My
Feel
daughter's supposed to come. She's
Oh, great.
finishing up work, so.
That's okay. She can just pop in whenever. That's fine. Hello.
Okay.
Hi, I'm Dr. Lena. How are you?
Good. How are you?
I'm good. Oh, Laura, you want a name tag?
Oh.
Because I'm not going to promise I'll remember everybody's name. Okay, there you go. And you are
Alicia Cabrera.
Alicia Cabrera. Welcome.
Thank you.
All right. We just get everybody signed in here. Folks are coming in from work and doing all kinds of things. So I'm just trying to
Yeah.
give a
Okay.
couple of extra minutes.
Yes.
I had gotten into this habit of starting like right on time.
Oh.
Um, Especially because so many military people are around here and they're like, what do you mean you're late? And so I was trying to get into that habit, but I also try to be a little bit patient again because people are coming
Yeah.
in. So anyway, I think I have your number because I texted you. What's your
Mm-hmm.
email address?
It's AJ Cabrera 21 at yahoo.com. That tells you how old I am.
I wasn't gonna say anything. I mean, I'm looking at all of us, and like we have these easy email addresses, but
That's
that's
my
because we had
favorite.
we got in early.
Yahoo's my favorite. So I got a Gmail, but I don't
I
use it.
mean, what? It's all about the Gmail. What are you doing? I'm
I
just
don't use
kidding.
it.
I'm kidding. It's whatever works for you. Seriously. All right, let's get you on here, Alicia. There we go. All right.
I can
There
sit
you go.
anywhere.
Yes, you are welcome to sit anywhere you're comfortable. I am recording the session, but I am not recording y'all. Like, I can't see you on the camera because I checked. Like, if you even sit right here, you still won't be on the camera. Just so y'all know. Like, I can't see you on camera right now.
Okay.
Just so you're, I think a little tiny pink leg.
Okay.
Right, that's it. That's all. Like, you can look. That's all that's on
Yeah, I
there.
can see.
Yeah,
Is there
yeah.
a handout or anything? Are you gonna be writing
Um,
anything?
no, you can take notes if you like.
Okay.
I mean, if you take notes on a pen and paper, I could probably find something for
Okay.
you.
No, it's okay.
Because I used to give out, little things for people to take notes, but people didn't actually use them, so I
Yeah.
stopped.
Okay.
But let me see what I can scrounge around since
No,
we're
it's
still
fine.
waiting. Look, there's always things in the purse, right? Let's see. It's probably gonna be in here. Yeah. All right, we're gonna give everybody maybe 2 more minutes, and then we'll get started because I don't want to keep y'all late. Look what I found. I'm very glad that you're so easy to please.
Thank you.
You even did a little dance. Hello. Hi. I'm Dr. Lena and
I'm
I'm
Robin.
Robin.
Mute.
Okay. With like the best nails in the house. Those are beautiful.
Thank you. I just got them done today.
Oh, I like that.
They needed.
That iridescent look. I used to
Mm-hmm.
do that all the time and then I stopped.
Yeah.
And see, now you're making me want to do it again.
I know.
Well, welcome.
That's the one thing I did in my for my
Okay. Well, here's another thing. This is the second thing.
And phone number?
I think I've got it because didn't I send you a message?
Yeah, you did.
Okay, so just your email address. I know we like to get the same information over and over, but I'm trying not to do that.
Yeah.
But whatever it's worth. All right. You are welcome. You can sit anywhere you like. Disclaimer for tonight, I am recording the session,
Oh, okay.
but I'm not recording you guys.
Oh, okay.
So you won't be on the video.
Okay.
Unless you want to and then you just jump in front of the camera, like you're welcome.
But like,
Yeah, exactly. But
do
that's
something like that.
completely up to you. If you want to do that, all of YouTube Live will see you do that. Um, yeah, it's quite warm out there. So, okay. That's what we're doing tonight. And we're gonna give 60 more seconds. We're on a countdown
We've done the.
for whoever else might want to show up. And if your daughter will come in late, that's completely okay. Like that doesn't bother me. Like I won't be like, oh no, I forgot what I was saying. Like I won't be like that.
The menopause is already done.
The what? Oh,
It's already shipped.
gotcha. Hopefully that'll get things under control for you.
You know, it was hard in the beginning, but I didn't do any hormones.
Hmm.
I did it all natural.
Okay.
So,
Okay.
because I'm a kind of a hormone.
Gotcha.
To do everything on
All right. Well, this might be appealing to you. We'll see. Okay. So y'all sitting a little far back, but you're gonna make me no, no, no. You're gonna make me project my voice, which is a good thing for the camera. No, it's a good thing for the camera. It's perfectly okay. Now, if you cannot hear me, please just say, speak louder. My mama's been saying it my whole life, I won't be offended. Okay? My voice tends to trail off, and I promise I'll be okay if you just ask me to speak a little bit louder. All right, so we'll go ahead and get started then. Welcome to everybody who is online, and welcome to all of you who showed up in the room. Thank you for even showing up. The name of this talk is Stress, Hormones, and Health. My name is Dr. Lena Gamble. So let's get started. First things first, this talk is going to be all about you, okay? So there are people who are looking for better ways to do things, more natural ways to do things, folks who are kind of fed up with our healthcare system, all of those things. Whatever your situation is, chronic diseases, fatigue, just not sure what's going on with your body, haven't been able to figure it out, all your labs are normal, all kinds of things are going on. This is about you tonight, okay? So I'm going to ask if you haven't already, this is also my reminder, put your phones on silent. Yep, I always have to remind myself. So I try to remind you guys when I remind myself. Um, but yes, if you have questions, I'm going to ask that you hold them to the end. I will give, a little bit of room for questions at the end. And I hope to answer a lot of your questions as we go through. Now, with that said, this is going to be a little bit interactive as well. So you do get to kind of answer some questions and talk to me throughout this. 'Cause otherwise, you might fall out of your chair and fall asleep. Okay? So now, before we go too much farther, I want to talk about purpose, right? Because we're going to talk about health and all, sorts of interesting information about hormones, the healthcare system, all these things. But none of that matters if you don't have a reason to be alive, right? If you don't know what your purpose is. And some of us have different purposes, but a lot of us, are interested in staying connected with our family, right? We want to be around for children, grandchildren, that sort of thing. There's a drive or a goal, something that we want to achieve, right? There's always a purpose. And so if you don't know what your purpose is, that's one thing that you might want to kind of pay attention to, all right? Because at the bottom, at the end of the day, that's going to be your driver. Like what gets you up in the morning? Why do you want to be healthy? What are you trying to achieve? Um, okay, so a little bit about me. Again, my name is Dr. Lena Gamble. I went to UAB. I started a company called Precision Health after about 10 years of doing family medicine. I travel all over the world and practice medicine as well as a missionary. But practice here in the US has become beyond frustrating, right? There's too many people wanting to dictate to me, the physician, how to handle my patients, what I can do, what I can prescribe, when I can do certain things that aren't necessarily always in the patient's best interest after, 12 years of school and 10 years of practice, right? And so, our system is designed in certain ways, and we'll talk about some of that. But my frustration with the system, which doesn't allow me to get to the bottom of your problem and fix it, right, and address it in ways that we know are natural and supportive of your body. Your body's designed to heal itself. You'll hear me say that multiple times. And our job is to support that healing. Now, there are some interventions that we need to make from time to time, which are also important. And so we'll talk a little bit more about that. But that's about me, who I am, why I'm standing up here in front of you, is because I also am frustrated with the system. So today, what we're going to cover tonight, America's healthcare crisis. Um, is it going to do? There it is. Okay. Stress, hormones, and health. We mentioned that before. What the underlying causes are of some of these chronic illnesses that we're facing. How to take action to protect your health naturally. Okay? And my promise to you is that I'm going to share as much information as I possibly can in the next 40 minutes, all right, about stress, hormones, and health. And then I will make you an offer, okay, of one way that you can move forward to take action, right, to make a difference in your own health. Now, it's important to understand, regardless of whether you walk away and say, this is the thing for me, this is the offer, I want to take advantage of it, what are the next steps? Even if you don't feel that way, in this next 40 minutes, you're going to learn something. Okay? Everybody gets to walk out of here knowing something that they didn't know before. All right? So that's the goal. Sometimes this works, sometimes it doesn't. Okay. So again, if you're feeling overwhelmed with the system, if you're feeling stressed, you're not feeling as good as you know you could be, and you're not sure what to do about that, right? If you know you should be doing things differently, but you don't know how or where to start, if you realize that health doesn't come in a bottle, okay? So first thing I got to, this might be a little bit of a downer, so I'm sorry, I'm going to apologize up front. I do not have a magic pill. Okay? I don't. I just, if I had one, I promise you I'd give it to you. Okay? And it would fix all your problems and everything that's going on. That's not what we're here for. I don't have that. Okay? So if you realize that health does not come in a bottle, right? There's not a quick fix for this. And if you're willing to take ownership, right? And so there's a lot of people who understand that there's an issue, but there's not as many people who are willing to say, I'm going to do something about my own health. Okay? But if you are, this talk is for you. So let's get into it. Anybody ever felt like that? Oh my gosh. This looks like what my mom looks like when she comes home from the doctor, right? Just overwhelmed. There's too many things going on. Don't even understand all of it. It's confusing. Just, yeah, right? I'm seeing nodding heads, so I'm guessing you guys are able to relate to this, right? What you may not be aware of is this is how I feel at the end of the day, right? Your provider is just frustrated and wanting to be able to do more. I guarantee you, everybody at your doctor's office signed up to work there because they wanted to help people, right? That's what they started off trying to do. And then somehow we end up in this system that's not letting us do the things that help people, and it's extremely frustrating. Then, unfortunately, we see patients who end up like this, right? Who've been successful, who've built things, who've built businesses, done all kinds of cool things in their life, but never did actually prioritize their health. Never did stop and take the time and say, what things should I be doing? What should I be planning? How should I be taking advantage of the time that I have so that I could avoid, being in this situation, right? And I've seen that patient over and over again. So as we age, and I have to say we at this point, um, as we age, are we getting sicker or healthier? More diseases or less diseases? More, right? Are we taking more medicines or less? More. Yeah. And then once we give you more medicines, do we stop those or do we give you more medicines for the medicines? Right? That's the trend. That's where we are. This is where our healthcare crisis comes in. Right? So there are what we call unacceptable costs and unacceptable outcomes. What we're looking at now, $3.5 trillion spent every year on healthcare in the US. 90% of that is on chronic diseases. That is a very big deal. The top 70% of all deaths are caused by the top five. Top five chronic diseases are responsible for 70% of all deaths, right? And we're spending $3.5 trillion on that. That's a lot of money. Here's the kicker. This is the part that I don't like the most. I already don't like these statistics, right? These are not good. But this is the one that really bothers me. Of the 40 countries, the U.S. is ranked 37th in our healthcare outcomes. 37 out of 40 after spending that amount of money per year. That's a problem, right? You think we might be able to do better. So this always makes people laugh. I love this slide. I was thinking of taking this slide out, but it just makes people laugh. So anyway, these are the things that the chronic issues, right? The just constant things that we're trying to help people with, that we're spending this money on, right? Bowel issues, like gastrointestinal issues, right? A lot of people have those types of things. Just fatigue. You're tired, you're sluggish, you don't know why. All your labs are normal. Something's going on, right? We haven't figured it out. Okay? Depression and psychological issues, right? Those things are a factor, a big time factor for lots of people. Anxiety is another, right? Falls right in that same category. Insomnia, right? Unable to sleep. You think that might affect you if you have that chronically? Absolutely. Your body doesn't get the rest that it needs in order to restore and heal and do all the things that are necessary. That's a big deal. Mood swings, emotional, some of that menopause stuff, some of it not necessarily tied to menopause, some of it tied to other types of hormonal imbalances. It's all possible. And then some of us are still battling the weight gain, right? Especially that abdominal, just can't get it to budge. Like, what is going on, right? Trying to figure out how to manage these types of things. So here's one testimonial of a lady named Vicky who was sitting right out there where you guys are tonight, and she didn't know what to expect. She just was listening to a talk, and was just like, well, I'm just gonna give this a try. I'm just for the next 6 months, whatever these people tell me to do, I'm just gonna do it because I've been doing all this other stuff for all this long time, and it hasn't gotten me where I need to be. So she did that, and she says, in her own words, it changed her life. Okay? She says, I lost 40 pounds, my digestive problems went away, I no longer need anti-inflammatory drugs, and I decreased my other medications. Right? And that's just in 6 months. So giving it a try is something that she's just willing to, just get over the hump. And we'll talk about giving what a try in a little while, right? This is where we are. Here's the big question. Do you think we have a problem with wrong information or lacking information? Both? Anybody else? Both? 2 votes for both? That's my vote too. My vote's for both, right? There's a lot of information out here, and especially for those who haven't dedicated their lives to going through this type of information, it can be confusing. And then some of the information is wrong. Well, how is it that we're working with wrong information? Well, as a scientist, I can tell you our information, our knowledge changes, right, over time, right? For a long while, we used to think that the sun revolved around the earth. Now we know the earth revolves around the sun, right? And information changes over time as we study, as we learn, as we do more tests and things, right? So this is what can happen, and what we end up on is a sinking ship. This is what our healthcare model looks like right now. It's a sick care model, right? And it's very effective. So I want to be sure that we understand we're not throwing the baby out with the bathwater, right? Our entire healthcare system is not bad, and that is not what I'm saying at all. Is this your daughter? I don't know. There's somebody outside. I don't know. Oh, oh no. I hope everything's okay. Go call him, please. Yes. Here, come this way if you want. Okay, okay, good. Yeah, yeah, yeah. Oh, it's okay. Come on, it's an emergency. It's okay. Yeah. I didn't know. I just saw a pretty girl outside, and I was like, maybe that's your daughter. I don't know. You can't see her standing right here outside the window? Oh, oh, she walked. Yeah? Okay, yeah, tell her to come in. Brief pause, internet people. Got some things happening in the real world here.
I think it's true that, like you said, normalizing information.
Yes,
The older you get, you remember all these things that keep changing.
right? Yeah, it's interesting. Hello, welcome. We were waiting for you. No, I mean not in a bad way. I just was looking out the window and I was like, "Oh, there's a pretty girl out the window. Maybe that's your daughter." And so yeah. Anyway, but yes, you're right. I remember talking to my grandmother about DNA, and she's like, "They didn't have DNA when I was in school. Like literally, it wasn't discovered yet. Like this is." And the information changes again as we learn more, as we experiment more and discover more, that information changes. So we're just talking a little bit about our sick care model. The thing about our sick care model, however, it has worked. So the reason that we got here is because the sick care model worked. And I'll prove it to you. How many of you know someone who has died of polio? Yeah. I mean, like in the past 5 years. Exactly, right? A long time ago. Nobody knows of anybody these days who's died of polio. Are you kidding? Yeah. An iron lung. Does anybody know anybody in an iron lung? Back in that day, everybody knew somebody who had been in. Why? Because the sick care model worked. They attacked the sickness, right? And solved that problem. And now people are living to 80, 90, 100 years old, when back then the average lifespan was 52. Anybody know somebody who died in their 50s? Right? It makes us all very sad because it's like, but they were so young. Well, back then, the sick care model came about because people were dying at that age, and that was like normal. Kids would die of pneumonia, right? Like that was a normal thing. Anybody know anybody's kid that died of pneumonia? Like that's not a thing. The sick care model worked. What it doesn't work for, though, unfortunately, is staying healthy. So now that we can live this long, because we're not dying of pneumonia and polio, how do we stay healthy? Well, the model wasn't designed to figure that out for us. It was designed to address sickness. It wasn't designed to teach us how to stay healthy. And so now we're stuck here, all these long years, extra decades, and we need to figure out, okay, well, what's the next step then? How do we stay healthy? Um, this slide is I like this slide. So the model that we currently have is built on the backs of the pharmaceutical companies, right? Because they addressed the sicknesses. And so what they tend to do is give us all these messages. I can prove that to you as well. Somebody see if you can finish this sentence for me. Milk does a body good. How is it that everybody knows that answer? I've never given one talk where somebody did not know that answer. That is not an original thought. Nobody was sitting at their house and thinking like, oh, I think milk, like, it probably does my body good. Nobody thinks that. Money did that for us. That's how the advertising works, right? It gets us thinking certain things. I'm gonna knock this thing down. um, what has that done though in our society is it's driven us to this idea that we don't have control of our own bodies. We need these external forces to come and control our bodies for us, right? They tell us that, we can't be proactive. We can't use food as medicine, right? We need a pharmaceutical company to give us medicine. We don't need food, right? We can't address our own blood sugar imbalances. We can't address our own autoimmune issues, right? These are the messages. That pile of money, billions of dollars goes into giving us these messages every single year. Now, there are some things that we can do, right? Here are some options, and I'll bet everybody in this room has tried one or more of these options before to try to figure out how to handle their own bodies, right? This is the year I'm just going to eat better. I'm just going to have better nutrition. I'm going to go on a diet. Or this is my year to do exercise. I'm joining a gym, and fitness is going to be important to me this year, right? Like we've done these things. Sometimes we've done a detox, right? A drink, a tea, a powder, or something. Like we're just going to detox and flush our system, and right? We've tried certain things. And in and of themselves, these things are actually good things. What we'll talk about too is what that red puzzle piece is. That's like the little magic puzzle piece that helps out in ways that pull the rest of them together. Now, big question on the table, how did we get here? Right? So this is where we talk about some of the fun stuff. How did we get to the point where we have these chronic diseases? Well, if this will click for me, there we go. Anybody dealt with some physical stress? I mean, maybe you're not actually playing football, but anybody been in a car accident? Anybody had a fall? Right? Your body takes in that stress, right? And that affects you. That physical stress, that's a big deal. There's other kinds of stress too. Some of the stress we do to ourselves, right? Alcohol, drugs, vaping. Like, we don't even know what that is. It's not cigarettes, it's something, though. What is it? Okay, who knows, right? It's something, but it's a chemical stress. We're putting it in our bodies, right? And if we're not doing any of those things, there's pollution in the air. There's pollution in the water, right? There's substances in our food that we take in every single day. It's also causing stress on our bodies. So this stress is a big part of what's affecting us. Anybody ever had this kind of stress like this lady? Oh my gosh. Every time I look at this slide, I just feel stressed. Like, if I had all that paperwork and some boss standing over my shoulder, oh my goodness gracious. Yeah, right? But we get stressed from work. Whatever our work situation is, it does cause some amount of stress. Hopefully not this amount. But, there's some stress. Now think about you working for 20, 30, 40 years under stress. What is that doing to your body? Right? And then we have our emotional stress as well. Like this guy down here is kind of angry. We've got family stress, relationship stress, just life. All these different stressors are affecting our bodies, right? And so this is where the majority of the issues come from, right? Our body's trying to manage this stress. And it shows up in chronic diseases. It shows up in all of those things I listed before, right? Bowel disturbances. It shows up in insomnia, anxiety, depression, stress. Would do any and all of those things. And our bodies handle it differently. But let's talk about hormones. Usually when I mention hormones, people think two things: estrogen and testosterone. Right? And that's typically where people's heads go. Well, when I think of hormones, I think of lots of things because there are lots of hormones in our body, not just those two. Now, What does that look like though? All these hormones have to be in balance. So if you think of like a symphony, right? You're going to go to the symphony and you're going to listen to this beautiful orchestra play, and it's going to sound magnificent. Well, what if you just want to just have one instrument just play louder than all the others? We're just going to throw some estrogen into this symphony, right? We're just going to throw some cymbals, and that's all we just more cymbals, more cymbals. More, it's just going to overpower the whole rest of the orchestra. This is not going to be in balance. They're not going to play together. It's not going to sound good. So trying to add one hormone, two hormones into the mix of what needs to be a balanced orchestra playing together, not really a great way to manage your body. Okay, but that's what we see these days. Now we've got fat storing and fat burning hormones. Okay, so who wants more of the fat storing hormones? Not me. I am not raising my hand for that. Right? Which ones are those? Insulin, estrogen, and cortisol. Who wants to get rid of all of their fat storing hormones? Also, not me. Not raising my hand. Why? What happens if you get rid of insulin? You have diabetes. Right? Like, again, these aren't bad just because they're in this category. We just talked about they're part of the orchestra. They have to be in balance. I don't want to get rid of my estrogen. I'd be like our lady who was here. There was a lady sitting there before you. I'm not pointing at you. But like, and she was talking about menopause as she came in. Well, that's what happens when you get rid of all your estrogen. Right? So it's not like we want to get rid of something and take more of some other thing. It's no, we want things to be in balance so they can work together like a beautiful orchestra, right? And so, fat burning hormones, growth hormone, insulin like growth factor, glucagon, thyroid hormones, testosterone. Now, I got a joke for y'all. I don't know if y'all find it funny. I like corny jokes. But anyway, so I saw this one online, and this lady was just like, "Oh my gosh, I hate my husband because we talk about every time we go on a diet, like he will just stop eating like 1 grain of rice and then drop 20 pounds, and I don't know how that's possible." And a lot of women were like, "That's so true. That's so true. Like my husband can always just lose weight. Like he just think about losing weight." Yeah, well, they have testosterone. We kind of don't really have as much. I mean, we have some, but definitely not like men, right? And so our bodies don't do the fat burning thing like the ones with testosterone do. And so yeah, I'm not saying go out and take testosterone, y'all. Again, we got to keep the orchestra in balance. Okay, but that's an important thing to note about our hormones, right? Like how they function, knowing which categories they fit into, right? So we can know how we need to be balancing things out. Now, this is where we end up typically because of the stress, because of the hormonal imbalances. Lots of people have one or more of these kinds of issues, right? And some of us in the room may have some of these kinds of issues. Well, what we typically do, this is how our sick care model helps us to approach this. And this is how I was trained in medical school, right? First thing I'm going to think, you walk into my clinic, which one of those diseases do you have? Which medical condition do you have, right? This is how I'm trained. What's going on with you? Figure out which one of these is the problem. And then the next thing, what drug do I have that can fix it? Right? Again, this is the training. This is how it works. And this is our system. And then the pharmaceutical companies, right, they come in because we're in the sick care model. They want us to think they have the solution for whatever problem we just named. And y'all know this is true because if anybody watches any time daytime TV, what do all the commercials have? Somebody, right, like running through a meadow or something, and and they're like, they have this disease, and they name it for you. And we have the answer. We have this drug. Ask your doctor about this drug. Like we don't know, right? Like it's just like, come on, right? This is the model that we currently have. Why? It's regulated by the government. So for people who aren't medical, Insurance companies are regulated by the government. They get their guidance from Medicare, right? And I looked up this statement because I'm not one of these people that just believe that they're all out to get us and stuff. And so I'm pretty skeptical of stuff like that. But I looked this up. And this is actually in the Medicare guidelines. We can go and find them because all of our information is public record in this country, right? And so it says care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary and therefore not payable. Anybody think that might be a problem? Right? This is our sick care model. This doesn't move the needle. It doesn't move the needle. Like the way things work, if you come to my clinic to see me, I need to figure out what's wrong, figure out what drug fixes it, and the pharmaceutical companies come in and they let us all know which drug will fix the problem that we discovered. Why? Because just keeping you healthy, there's no code for that, right? We build insurance companies with codes. There's not a code for keep you healthy because the guidelines say that that's not medically necessary. And that is how we end up here. Yeah, that's pretty sobering. So our broken system, right, about to just go under, is because of these kinds of reasons, right? We're spending billions of dollars on drugs and doing things to respond to individual diseases and issues, again, that worked in the past, but probably is not going to be the solution for what's ailing us now, right? The question now becomes, are you willing to do something different? Knowing this, knowing that you can go to your regular doctor, set up an appointment tomorrow, and what they're going to do is what I just described. Figure out what's wrong, figure out what drug, and let the pharmaceutical companies dictate what to give you. That's what I do in the clinic because that's how I've been trained, right? That's the system. But if you're wanting to do something different, let's talk about what that could look like. Remember we talked about purpose? You have to go back to your why, right? You have to understand, because if you don't have something that drives you to do something different, you're not going to do anything different, right? That's the bottom line. So here's my why, right? As a missionary, like I said, I get to go all over the world and take care of people and do fun things. I get to teach. These are some nursing students in Angola. I get to, I went to Ukraine like right after the war started. You know, there's all kinds of things that you get to do. Bye-bye. Have a good one. Yeah, there's all kinds of things that I get to do, and that's my why, right? Like I have to be healthy enough to be able to go and do all these things. What do you have to be healthy enough to be able to do? Right? Becomes the question. And once you figure out that why, it helps you break through the barrier. And so now we get back to the things that we all know to do, the things that are important, right? And so, anybody got any idea what this one down here at the bottom is? This red one? Anybody guess? Eat healthy? Yep, we got that one covered with nutrition. That was a good guess, though. Don't wreck your brains too hard, I'll tell you. If it clicks. Okay, we'll talk about these first, the ones we already know, right? What's the purpose of food? To taste good. That is not the purpose. I know. We all think that's the purpose, especially down here in the South. Oh my goodness. To sustain life, right? To support your body. That which is eaten to sustain life, provide energy, and promote growth and repair of tissues, right? We can actually use food as medicine. That is a real thing that we could be doing, which means how many times you eat a day, 3, 4, 5 times with a couple of snacks in there, you could be doing the things for your body that you need to heal yourself 3, 4, 5 times a day already. That is a real thing, okay? So if you don't take anything else away, just know that you could be self-medicating with food already. You don't need anybody's help to do that. Now, detox. Anybody ever tried to detox before? I haven't. Well, I mean, I take supplements that are actually excellent for detox, but they're not the regular kinds of the ones where you have to stay outside the bathroom and like you can't go anywhere because, right? Like, yeah. The type of detox that's important are the ones that actually support what your body already is capable of doing, right? You've got amazing detox organs already in your body. Your liver, your kidneys, your gut, and your skin are amazing. I can tell you, despite all of our efforts, we, scientific community, doctors, etc., have never been able to duplicate what your kidneys can do. Even with the best dialysis, I don't know if anybody knows anybody on dialysis, right? It tries to do what the kidneys can do, and it does a fantastic job. It can keep people alive for years. It cannot duplicate what the kidneys can do. We have never been able to beat God at his own game. That is just the truth, okay? But what can we do? We can support our body's natural ability to detox. And so that's also very important. Not this. I don't know if this depends on your age if you're familiar with this or not. Right? Because my older folks are always laughing and my younger folks are like, what's that? So it just depends. And I'm like in the middle, so it's funny because I kind of can relate to both. But yeah, so that's like an enema thing, and this is not what we're referring to when we're talking about detox, okay? We're not talking about completely emptying your gut and all of that type of thing. That is probably not even healthy. So, fitness. Lots of ways to get involved in fitness. Our sedentary lifestyle is a problem, right? Everybody knows this. This is not a secret. And we still don't do the things that we need to do. Very important that we engage in some kind of way. Probably not that kind of way. I do know someone who can do this. It's really impressive. I should tell her to give me a picture so I can have a picture of my friend up here. But yeah, it's yeah, the people who do these things. This is not what I'm thinking when I'm referring to fitness. Okay, we're like regular people. We're not people that can do that, right? So us regular people need to be doing some regular fitness, like going for a walk, right, or playing pickleball, or doing whatever we find fun. But there needs to be some type of movement, some type of activity. And then we get to our hormones. We talked about the symphony, right? And the multiple types of hormones. So they look differently when they're out of balance. You have a different body habitus when your different hormones are out of balance, right? And so addressing those, figuring out which ones are not in balance and bringing them back into balance, right? That's what we want to do. Not just I'm going to take more of this one hormone and hope it makes my whole orchestra get better. I think that doesn't make sense. And then we figure those things out with the different labs, right? So that's one of the ways we do that. And then finally, I told you I was going to tell you what this red one is, right? It's mentorship. Well, why is that important? Because if you wanted to address all four of these at once, do you think you might be overwhelmed? I would be overwhelmed, right? And I got all these degrees. Like I would need a system in place to show me what does that look like. And then the mentorship brings in accountability. It brings in somebody who walks you through step by step. What do you do on day one? What do you do on week two? What do you buy at the store so that you can manage your intake, your nutrition better, right? All of those things like literally just given to you and somebody just hand holds you through that process. So that at the end of the day, at the end of 6 months, like Vicky, right, who was able to say, like, oh my gosh, I just did whatever these people told me to do. I didn't figure it all out. I had a mentor. I did what they told me, and then I felt better. And then my labs were better. And then I was off some of these medications, right? That's the idea. Again, most of us have ended up looking like this person, right? Trying to figure it out, myself included, trying to figure it out. And a mentor puts it all together for you, right? And so now you don't just have these random things that you're trying to do. Like, no, you actually are doing them all at once because somebody's helping you and walking you through the process. And so that's the goal. And the way we do it is through a customized all-inclusive system. We put all those missing pieces together for you in one system that works extremely well. And then you're off that sinking ship, right? And you're who would prefer to be on this type of, right? I'm just, I would like to go on that type of boat as opposed to our sick care model boat that's sinking. In order to do that, though, we can't be like our fat cat here. Like this, that's not going to get the job done. Yeah, that won't work. So I'm gonna tell you another testimonial. This is from Lynn. Lynn was a nurse for years, right? She says she's been diabetic for 16 years. She weighed 234 pounds and was on 120 units of insulin and three other drugs. She was surrounded by doctors, right? She was a part of the healthcare system. And for 16 years, she was tired. She had achy joints. She didn't feel well. She literally says, I never felt well. Like, come on. This is a smart person who's been through a lot of school and who knows, the ins and outs of things. And she couldn't figure out how to get it to work. For the last 10 years, she had tried eating right, exercise, nothing worked. Now, she joined in with the system here, right, that we offer. And in 3 months, she lost 70 pounds just from changing. These kinds of testimonials, I think, are very nice. They don't mean that much to me at all. I ain't gonna lie, right? As far as data, right? And if you're evaluating data, oh, this one person lost weight. Okay, I don't really care that much. Here's what I care about. Her A1C went from 9.8 to 6.6. Why does that matter? I don't know if anybody has diabetes or knows anybody with diabetes, but A1C is how we manage your diabetes and tell if you're getting better or worse. 9.8, definitely worse, right? I want you on actual insulin, not just on pills, right? Like there's ways to manage that. That's not a good number at all to be at. 6.5 is the cutoff for diabetes. That's how I diagnose if you have diabetes. Is I look at your labs and I look at your A1C, and if your A1C is 6.5 or above, you are diagnosed with diabetes. So she's saying in 3 months, she was able to get her A1C down from 9.8 to 6.6, where she literally almost didn't even have the diagnosis anymore. That's impressive. Uh-oh. Hey, don't do that. Power back on. Please. You can do it. See? Oh no. Oh, came right back. I'm so happy. Okay. Um, yeah. So she didn't hurt anymore. Her pain went away. That's a big deal. She's dealing with pain every single day in her joints, aching joints. That's likely autoimmune types of things. Oh, the battery is low. Okay. Well, if it goes, it goes. We'll just do the best we can. All right. And then her worst fear was that she wouldn't be able to stick with what we were telling her to do. But at the end of the day, she said she didn't have any cravings. She had no problem sticking with what we asked her to do, and that this is her life plan now. Oh, it's going off because of insufficient battery. In that case, we are almost done. And we're almost done anyway. Ooh, because I told you guys 40 minutes, and it's been like 36 minutes. Ha! So I'm doing great. Let's finish it up then. So, the idea, though, at the end of the day, is that you have to take ownership. So both of these testimonies that I just showed you, the one with Vicky and then the one with Lynn, um, do you think that the insurance company paid for that? Mm-mm. That's the correct answer. Mm-mm. No. Why not? She got better. Her health got better for sure, right? I mean, you're taking some long-term side effects from having diabetes off the table. That's important. You would think insurance would pay. It's not medically necessary according to the guidelines. You're absolutely right, and that is extremely unfortunate. But that's the guidelines, right? And so taking ownership and saying, okay, I don't care if somebody else is not going to pay. I'm going to figure out how to do this for myself. That's what these folks did. They literally took ownership of their own health, and that's super important. So, what's next? Right? What's the next step? Well, I hope I've given you information that you can walk away with, right? And do something differently for your health because that's what my goal was, right? To keep that promise to you. And so now, if you're interested, the next step would be to have your own one on one session with me, right? So a 60-minute session where we would go over your own personalized wellness strategy session. One thing that I don't have is a cookie cutter program to offer to people, right? Like I don't have any one size fits all. What I can do is design a program that's individual based on your history, your goals, your obstacles, and how to move you from where you are to where you want to go. Now, when I'm seeing patients in the clinic, nobody ever gives me 60 minutes. The national average is like 8 minutes, right? That's just the reality. You can't do very much in that amount of time. That's why I set aside actually 60 minutes to make sure that we can discuss what's actually going on with you, what your history is, and then what steps we need to take to move you forward, right? That's the goal. The total value of that is $250, where we would do a consultation, a wellness evaluation, and a plan of action. Now, when I come out and do these types of talks, I do offer that session for only $87. And so, if you would like, I'll hand out a form that you can fill out, and we can go ahead and get you put on the schedule for that type of session. Okay, because that will be the next step. Now, does anyone have any questions at all? No? Come on. Okay. I'll give you a couple of frequently asked questions. One, are these programs affordable? Right? The types of things that Vicky did for 3 months and that Lynn did for 6 months. Like, is this stuff affordable? Well, the answer is yes. We've got all kinds of people. I have patients who are on a single family income, single moms. I've got folks on fixed income, retired, like not making money, anymore and just have whatever their fixed income is. All kinds of people. The one thing that you have to do, the one thing you have to want to. If you want to, we can figure out the rest. But you have to want to. So that's the biggest deal for me. Now, if you're willing to come in and say, I want to make a change, I'm ready to make, a difference in my own life. I've got my own purpose. This is what I'm trying to do, but I need some help. We're gonna help you. That for me, that's the beauty of it. That's my purpose. I get to do that. Okay. Um, this is an online option because I travel the world, right? And so